Good afternoon and welcome to our webinar today on the Behavioral Health Centers of Excellence. My name is Uzma Rahman and I'm the branch chief over the Medi-Cal Special Projects branch in the Medi-Cal Behavioral Health Policy Division here at the Department of Healthcare Services. During today's session, DHCS and Health Management Associates, or HMA, will be providing a high-level overview of the behavioral health COEs. This will include background information on this initiative, an overview of the COEs, and their associated evidence-based practices, or EPBs, and how to initiate engagement with the COEs. In addition to DHCS and HMA, we wanted to acknowledge the Manat team as a key collaborator for DHCS as policy consultants that support the intersection between BH Connect and BHSA. If you have any questions during today's session, please feel free to leave your question in the chat or Q&A feature at the bottom of your screen. With that, I'm going to pass this over to Patrick from Health Management Associates to begin the presentation. Thank you again for your attendance.
Thank you, Uzma. So my name is Patrick Metters. I'm the Associate Principal with Health Management Associates. We are an independent national research and consulting firm with expertise in multiple disciplines, including behavioral health, which is part of our role here. DHCS is partnered with HMA, is the Behavioral Health Center of Excellence administrative entity. You may have questions about what that means, but we're going to discuss a bit more about that role later on in this presentation. Before we get started, we did want to go through just a few housekeeping items. The first half of today's presentation, where we go over the slides, it is going to be recorded and available. We're going to place it on our Behavioral Health Centers of Excellence resource hub. That resource hub, the link to that will be dropped in the Q&A session or in the chat, and will also be sent to everybody via email following this call. Additionally, we should also share that the recording and the slides will also be included in that email and be placed on the Center of Excellence Resource Hub. After the presentation is complete, we'll go ahead and stop the recording, and if there's time left at the end, we'll make sure that we have the opportunity for folks to ask questions. I do want to request that everybody who has a question, rather than using the chat, use the Q&A portion or function that's at the bottom of the screen. That'll allow us to track all questions, and also ensure that you have a written response that will come following this session as well. That will also be included in the follow-up email. If you can't find the Q&A function, click on More, and you should see the Q&A function from that point on. Okay, so let's go ahead and go to the next slide. So during today's presentation, we have a number of things we want to make sure we go over. One, we're going to go through an introduction and overview of the Centers of Excellence, as well as our role as the administrative entity. You also get to learn a little bit more about what the role will be for those Centers of Excellence. I think the other big piece that is a part of this webinar will be how do counties really engage with the Centers of Excellence across each of the evidence-based practices. So we'll go over that engagement process. And then we also have some follow-up webinars and other engagement opportunities for both counties and county practitioners that we'll make sure that you have access to, and we'll go over next steps and questions at the end. I think it's also important that we probably clarify too, and I know some of these may be burning questions, but today's session will not be covering anything related to policy guidance, especially around fidelity requirements, any billing related questions, or data elements and reporting requirements. Any questions related to those topics we will track, but we will not be answering at this time, and additional guidance is definitely forthcoming, which we'll talk about in some of the upcoming bins. The other thing we did want to clarify, at least as a part of this, the role of the COEs is really to support the counties and their contracted providers and practitioners in delivering high quality care. The COEs are not in a role for compliance, although they may advise the state and provide some input on training and monitoring requirements that really support some of that evidence-based care. It's really DHCS's role to set and enforce compliance to that policy. All right, and with that, let's go ahead and jump into our Center of Excellence introduction, and we'll go through If you'll go ahead and hop to the next slide. Um, so the centers of excellence were really established, and I think we can all agree that implementing evidence-based practices is really central to the California's goal of expanding access to and strengthening that continuum of care and community-based behavioral health services, especially for those individuals living with significant behavioral health needs. EBPs are really key components, not just of BH Connect, but also of BHSA, which we'll talk about how those two intersect as well today. Um, Essentially, DHCS has established centers of excellence across each of the EBPs. So we'll talk about each one of those in just a second. But there is a center of excellence that has been established to really support these efforts for both BHSA and BH Connect. They are also, if you look to the left there, you'll see each one of the EBPs that are listed as a part of both BHSA and BH Connect. Just to clarify, though, if you were to look at evidence-based practices that are included in both initiatives for BHSA and BH Connect, you're really looking at ACT and FACT there at the top, so assertive community treatment and forensic ACT. You also have coordinated specialty care for first episode psychosis, and you have IPS, which is individual placement and supported employment. And then finally, you have high fidelity wrap around, which I will clarify more guidance is coming around high fidelity wrap in the coming months, likely in Q4 of this year. Next slide. So when we talk about the implementation of these EVPs, I think one of the questions is always, how are these overlapping? Are there shared components? And part of HMA's role is really to ensure that we're implementing the EVPs in accordance to both, but also looking for ways that things can be streamlined when it comes to implementation of these EVPs. So when you look at the shared features between evidence-based practice and BHSA and BH Connect, you see there's three primary overlaps. One is the implementation requirements, so eligibility criteria, the staffing, the fidelity monitoring are both the same in both BHSA and BH Connect for those, again, that are overlapping those two initiatives. Additionally, the access to training, technical assistance, and fidelity monitoring support is the same. And then the workforce may also overlap. So the same teams are going to be supporting both Medi-Cal and non-Medi-Cal members. And I think there's already been some guidance that has been put out by DHCS, especially as it comes to opting in to provide ACT and FACT, IPS, and CSC in Medi-Cal under BH Connect, and that has started this year. You also probably remember that MST, FFT, and PCIT, as well as high fidelity wrap, are already required services that are covered under the early and periodic screening, diagnostic, and treatment initiative. Under BHSA, counties, and I think this is probably something to make sure that we're clarifying, from a timeline perspective, under BHSA, all counties must offer ACT and FACT, IPS, CSC for FEP, and high fidelity wrap starting July 1st of 2026. We're going to talk through how the COEs are going to help support that timeline here in just a minute. For EVPs in both initiatives, I think it's important to call out those core requirements are going to be identical regardless of whether or not a county opts into BH Connect. So if a county decides not to opt into BH Connect, the same requirements will exist for to meet the standard for BHSA. All right, I think that's it for that. We'll go to the next slide. So just to kind of highlight what already exists in terms of released bins and policy guides, and then also what is forthcoming. We're going to go through a few of these, but DHCS has released initial guidance on the coverage for EVPs under Medi-Cal and is currently developing detailed training, technical assistance, fidelity monitoring, and data collection guidance. So this is going to be incredibly helpful for the counties and practitioners to have that guidance. So that is still forthcoming, and it'll be for both Medi-Cal and BHSA. And then in April of 2025, you'll remember probably seeing Ben released really outlining the coverage, payment, and other compliance requirements that counties to really elect to cover ACT and FACT, IPS, and CSC for FEP under Medi-Cal. And then the following month, there was a policy guide that was released to really support that implementation of EVPs for both BH Connect and BHSA. In June, there was a draft bin that outlined the same coverage, payment, and compliance requirements, but for the children and youth EVPs. So for MST, PCIT, and FFT, they were all included in that guidance. I will note that the final guidance has yet to be released, but will be coming in the coming months now that public comment has concluded. DHCS will also include guidance on BHSA minimum service capacity requirements in future BHSA county policy manual updates. And it also will release some additional guidance related to training and technical assistance, fidelity monitoring, and data collection for each of the ones included in both Medi-Cal and BHSA. Again, and I mentioned this, I think, on the previous slide, DHCS is going to release some additional supporting implementation guidance around high fidelity wrap for both BHSA and Medi-Cal. So all of that is forthcoming. All right, next slide. So just to kind of follow up on the previous slide and maybe just show it to you in a different format, this also includes the 3 webinars that are included as a part of this effort. We'll have some key dates and timeframes really around policy guidance and the socialization of the COEs upcoming. The first webinar, this is actually the second of 2. There was one yesterday and then one today. This is essentially introducing the process as well as the Centers of Excellence. August 6th and August 7th are going to be more detailed specifically around the COEs and the EVPs for the adults happening in webinar 2. That is August 6th. And then there's also another one on August 7th for the children and youth EVPs. We'll go into more detail about what each one of those webinars entails at a upcoming slide. And then if you look at the upcoming guidance that everybody can anticipate coming, these are tentative timelines. Late August there is a public comment on draft guidance around EVP training and fidelity standards. Keep an eye out for that. There's also some upcoming, and it's still to be determined, draft guidance on really that minimum service capacity via the county BHSA policy manual. And then finally, you'll see in October, and again, a TBD, that the publication of both of those after public comment will happen later in October. Okay, next slide. So while we're just now introducing the Centers of Excellence, our Centers of Excellence have been working with DHCS since the late last year, actually. So to date, we actually went through a process and selected the Centers of Excellence back in November of 2024, and they were under contract at the start of 2025. If you remember, back in March and April, counties completed a needs and readiness assessment. All of the results from that survey were sent to the Centers of Excellence and were reviewed. And really, just in preparation for the launch of this, each of the COEs have really been developing that training and technical assistance materials and utilizing the input from the counties to really develop a statewide implementation plan. Opportunities, obviously, for overlap and synergy across the COEs has also been something that has been a point of discussion. So this timeline that's listed here, this is really what's upcoming. So, the webinars is that first bullet. So starting with today, we have a series of 3 webinars that's occurring. We also are going to have, and I think it's going to be mentioned on an upcoming slide, after the webinars for the adult and children and youth, the following week, there will be a question and answer session. I have no doubt there'll be lots of questions that we'll want to make sure get answered, and we want to make sure there's an opportunity for everybody to do some. So there'll be the following week, there'll be 2 sessions, one for adult and one for children and youth to have a Q&A session. And then the second bullet is the engagement initiation form. We're going to talk a lot more about that here in just a minute. The engagement initiation form can start to be submitted as early as today. We'll tell you what that is, but that is essentially going to be the opportunity for counties to alert the Centers of Excellence that they're ready for a consultation. We'll tell you what that means in terms of what a consultation is, but the engagement initiation form is essentially the kickoff for county engagement with the Center of Excellence. You can start to submit that, and I believe we will place the engagement initiation form link in the chat, and it will also be included in the email and the summary that comes after this webinar. And then in the upcoming 2 months, and this is probably even stretching into 2026, county consultations and training and technical assistance will be available for counties and providers. Those county consultations, which we'll talk about, will start soon after the counties have submitted their engagement initiation forms. Okay, I think we will go ahead and move on and talk a little bit about the role of HMA as the Center of Excellence administrative entity, and then we'll go into who the selected COEs are, as well as the roles and responsibilities. So, I mentioned earlier that DHCS has partnered with HMA, Health Management Associates, as the Behavioral Health Center of Excellence administrative entity. We really have four primary functions when it comes to serving as the administrative entity. We're responsible for really building the infrastructure and standardizing and streamlining those processes and engagement and collaboration across all seven COEs. Eventually, it will be 8 COEs as we start to bring on high fidelity RAP and a center of excellence supporting them. And then it's really intended to develop evidence-based practice model training, technical assistance, and fidelity monitoring statewide. So each COE is responsible for that training, technical assistance, and fidelity monitoring to the model. Additionally, the communication piece, where you mentioned the resource hub, the Behavioral Health COE resource hub is going to be that central piece where all communication will come from. It'll also be a place for counties and providers and practitioners to really find the latest and greatest related to this initiative. And so that can be the one-stop shop. We're intended to develop a centralized approach for how we socialize. Hence, we also have these webinars. We'll also have some upcoming opportunities, which we'll share to make sure that everybody is informed about this initiative. And then thirdly, we have the alignment. I think it's incredibly important as we roll out the implementation of these evidence-based practices that they're aligned with guidance from DHCS policy guidance, as well as for both BHSA and BH Connect. But we're also ensuring that the training, the technical assistance, and fidelity monitoring processes are also aligned accordingly. So our COEs are working hard with both DHCS and MANAT and HMA to really ensure that that is happening. And then finally, as an oversight, this is kind of the fourth pillar. HMA's responsibility is really to oversee the COE performance and ensure that it's scalable and a sustainable short and long-term strategy really related to this effort. I think the larger point is as the state has implemented each of these centers of excellence, we're really wanting to track and understand the impact of establishing this and supporting the counties and really developing the evidence-based practices across the state. All right. And then let's get into like the specific COEs. As I mentioned, the centers of excellence are really here to support training and technical assistance and fidelity monitoring for each EBP and really support both BH Connect and BHSA initiatives. And this slide really depicts all 7 that have been selected to support the state in this effort. You'll notice that high fidelity RAP is pending October 2025. You'll get more information about that, but there will be a center of excellence that will also support high fidelity wraparound. So there are 8 EBPs underneath this initiative, some of which are specific to BH Connect, some are specific to BHSA, and some are specific to both. For the children and youth, we have FFT LLC is going to serve as the COE for functional family therapy. Multisystemic MST services will serve as a COE for multisystemic therapy. And then PCIT International will serve as the COE for parent and child interaction therapy. Those 3 are the EVPs that are already supported under the or already required under the other initiative. Additional information about high fidelity RAP is coming on the adult side. We have 4 established centers of excellence. One is the UCLA's Public Mental Health Partnership. They're serving as the COE specific for assertive community treatment and forensic DAC. And then we also have EPICAL, which is Early Psychosis Intervention of California. Many of you may already be aware of their organization, but they have been involved in the state and are also working to support the coordinated specialty care for first episode psychosis. It also should be noted, even though they're on the adult side, CSE does actually serve anywhere from ages 12 up to the age of 40, and sometimes even beyond that age range. And then the third one there is IPS. So the IPS Employment Center will serve as the Center of Excellence for Individual Placement and Supported Employment. And then finally, Clubhouse International is serving as the Center of Excellence for Clubhouse Services. So for more information, and again, I got to continue to plug it, please visit that COE resource hub. There'll also be some additional information about each of the EVPs in the coming weeks as well. So as we talk about the roles and responsibilities of the COEs, we mentioned they're going to be available to counties really starting in the late summer. I think we can probably classify now as the late summer, early fall, to really provide that training, technical assistance, and fidelity monitoring and data collection. I think it's important to note here that the COEs are going to support both the county BH agencies as well as their practitioners. So I think just knowing that the COEs are there to support both and. Um, Initially, and I think this is where we start, the county consultations. So an engagement initiation form is submitted. The COEs are going to be responding. We'll talk about that process in just a minute. But then there's going to be a consultation between the centers of excellence as well as the county to really go through a number of things, which we'll talk about. After those consultations, then each of the COEs will really be tailoring the training and technical assistance specific to the county and behavioral health practitioners, both new and existing. I think we all can recognize that each county is unique and different, and so there needs to be some level of consultation and tailoring that needs to happen. And then finally, they also will be responsible for conducting those fidelity assessments to the model. So each of the COEs have written that into their responsibilities. In addition, they'll be collecting data to inform the continuous quality improvement and outcomes, realizing that some of the data may not necessarily come through the COE, but will help and support in training and technical assistance. Next slide. So probably the part that we need to spend a little time on is what do we do now? How do we engage with the Center of Excellence? So let's go to the next slide and kind of walk through what this process will look like. As I mentioned, it's a very brief form. It's an engagement initiation form that you'll have a link to. It'll automatically go to a database that HMA will monitor multiple times a day. Essentially, that will alert HMA that a county is ready. And by ready, we mean within the next 3 months, they would like to have a consultation with a specific center of excellence. Now, on this form, they have the ability, each county has the ability, you could opt and say, we're ready for all 7 COEs and to have a consultation across all 7. Or it may be that you want to submit an engagement initiation form just for one evidence-based practice and one Center of Excellence consultation. You can submit this form multiple times. So for instance, if you would like to let right now, you are ready for a consultation with the Act and Fact Center of Excellence. You can submit the form, and then next month you can say, yes, I'm ready to go ahead and submit another form for CSC for FEP. You have the ability to kind of tailor it towards your own readiness based off of that. What we do require, though, is that it come from the county BH agency director or a designee. So someone within the county who is a specified one that they're ready for this consultation, and then we'll go from there. More than likely, it'll probably be an initial consultation and perhaps some additional follow-up that will come. So when you submit the engagement initiation form, what will happen next is counties are going to receive a follow-up email directly from the Center of Excellence. And really, it's just going to be to help coordinate that county consultation. If you've indicated that you want a county consultation in 2 months, you still will get an email and you'll just work to make sure that that consultation is following at a time that works for you. But you'll get that email from the Center of Excellence within 3 business days of submitting that engagement initiation form. I think the second bullet, we do want to make sure we highlight because I think there may be some confusion as to the timelines related to this. We mentioned that within BHSA, there is a specific requirement for Act and Fact IPS as well as for CSC for FEP to be implemented by June 30th, 2026. In order for that to happen, the county consultation has to occur prior to that. So this timeline is really tied to that. So March 31st is really the deadline for all counties to submit a EIF specific to those BHSA EBPs. So Act and Fact, CSC for FEP, and IPS all need to be submitted by March 31st, 2026. The reason for that timeline is then we will have essentially 3 months for the COEs to really engage with the counties to further understand what the training and technical assistance needs are to support those EBPs. I will also encourage counties not to wait until that last moment because I imagine that will be quite a bottleneck if everybody decided to wait until March 31st. So as you're ready, I would go ahead and submit an EIF form and at least start the engagement with the county or with the COE as soon as possible. Again, we will send the link to the EIF both in the Q&A as well as in the email. I'll also mention that the EIF link is also live on the COE Resource Hub, and so you should be able to access it through the website as well. Okay, we'll move on. So once a county has submitted an engagement initiation form, and it is now the Center of Excellence has reached out to schedule a consultation. One thing that the counties really just need to be aware of is what may be included in that consultation. So on this slide, you can see what may be included. I think one of the things to really highlight here is that the counties really want to identify what specific needs and really advise on a tailored implementation rollout in the context of these existing services. So as we think about the target population, as we think about the minimum number of teams or clinicians that are needed, and really develop a plan for how to support your county, those consultations are going to be key. Now, I imagine most of these can occur virtually in a one-on-one format, or it may actually occur in either a small group setting, depending on the geography. But it will cover a number of these topics. It may not cover all of these because it may all not be relevant. However, I do think it's a great opportunity for the Center of Excellence to really better understand what's available in your county, assess what is needed, and really tailor the requirements and what's needed to support the implementation of the EBP. So you'll go down the list there. There is some county-specific timelines for ACT and FACT, IPS, and CSC, since those are BHSA specific EBPs. There are also resources available that might be needed. And just understanding those anticipated number of individuals, really those referral sources and where we can make sure that we're identifying how those referral sources might help support getting folks connected to the evidence-based practices. And then I think the second to last bullet there, really the adaptations for the rural areas or geographically dispersed areas, I think is also something that each of the COEs would want to discuss with the counties and come up with an approach that makes the most sense. Yeah. Okay, I think we'll move on. And then HMA's role in all of this is really to track that, right? So as the COEs and the counties are starting to become engaged and we start to develop tailored training and technical assistance programs, we're going to be tracking that engagement and really support not only timely connections, but the progress towards those goals. I think we're also going to be working with the Center of Excellence to really on the status of the county and team engagements and really assist anything that the COEs need to really address the needs of your county. And then finally, we want to monitor a lot of the data and report up any information that's needed to really support the timely access to the training and technical assistance and fidelity assessments. As you might imagine, across 58 counties, there's quite a bit that needs to be monitored, and the Centers of Excellence are going to be balancing a lot of different timelines. And so it's important that we give them the necessary support for that. And here's the hub that I've been talking about the entire time. There's multiple modes that counties and practitioners are going to be getting in touch with us, but to a certain extent, really where you want to get in touch with training and technical assistance and fidelity monitoring resources, that BHCOE resource hub will be updated consistently. It's going to have the most up-to-date information and should probably be bookmarked just to make sure that you remain updated with everything that's happening with the Centers of Excellence. The other option here too, and I think probably both is to join the newsletter. We will be sending out a periodic newsletter that has the latest updates as well. It'll also include some additional information specific to the Centers of Excellence. Perhaps it'll have some training opportunities or even some opportunities for collaboration across the counties. Plenty of information to include in the newsletter. We will drop that as well in the chat or in the Q&A piece so that you have access to that. You can sign up. We already have, I believe, I think it's over 200 folks that have signed up for the newsletter. You're welcome to continue to share that so that everybody stays informed. And then finally, I think it's important, and again, we love tracking so that we make sure one, your questions are answered, and two, it gets tracked to the right spot. If you have any questions specific to the Center of Excellence as it relates to BHSA or BH Connect, feel free to drop a question in this email here. This will ensure, one, it gets to our team, two, that we actually track it and forward it where it needs to be, as well as making sure it gets to the Center of Excellence. The challenge is if you go directly to the Center of Excellence, it may be something that gets bounced back and forward. If we start here, we can make sure it gets triaged to the right location, whether it be a Center of Excellence or DHCS or HMA. All right. The other thing I will flag, there is a larger BH Connect email address. So if anything that extends beyond the Center of Excellence, obviously BH Connect is quite a large initiative, and it's not just about the Centers of Excellence. If it's something related to incentives or something broader for BH Connect, you're welcome to start there. Either way, there will be a mechanism to make sure that they are getting tracked and forwarded to the appropriate entity. Okay. So if you'll remember, earlier on, I did mention there's a couple of upcoming webinars and engagement opportunities. I think our goal here is to, one, make sure that you're informed of everything that's coming. Two, we want to make sure that you have the opportunity to ask questions and we can clarify and give counties as well as practitioners the opportunities to engage with the COEs. So this will continue to evolve. As we go into webinar 2, though, that's coming up next week. The webinar is on Wednesday, August 6th, and that's at 1 o'clock. When you register, and I think this is an important note, webinar number 2 will happen at that time, but it will also register you for our Q&A session, which will happen the following week, Wednesday at 1 o'clock, but it'll be the following week. I will also mention that we will be recording that session that's happening for webinar 2 and make that available on the BHCOE Resource Hub. But I think I'll take a step back and go back to who should actually register for the webinar. We really want to make sure it's not only reaching county BH agency directors and designees and staff, but it's also anybody that the county is contracting with to provide the EBPs, especially for related to adult. Anybody that you have tagged that you think would like to know about this information or want to be contracting with the county, I think that's important for us to flag here. So really, it's a broad audience. We want to make sure that everybody is able to come and hear a bit more about the adult EBPs, as well as the Centers of Excellence and their roles. And then we'll get into a Q&A that follows. So we're going to go through a number of topics. We'll give an introduction to the adult EBPs. We'll talk about those target populations across each one, eligibility criteria for that as well, and then go into the training, technical assistance, and fidelity monitoring approaches that are included there. And then I'll say, and without repeating myself, if we go to webinar number 3, that is essentially exactly the same. If you want to go ahead and go to the next slide there. This is exactly the same webinar, except for it will involve both just the children and youth EBPs. So we'll look at FFT LLC, PCIT International, and MST Services. They'll be presenting and going over the exact same topics, the overview and introduction, as well as the training, technical assistance, and fidelity monitoring approaches, and the same folks we would like to have invited as the principal audience there. You will also register for the Q&A session for webinar 3 and Q&A that follows the Thursday after that as well. I did want to also flag that both of these sessions likely will not have a live Q&A session. However, what we will do is we will track any questions that are submitted for both webinar 2 and webinar 3. We will collate those and make sure they make it into the subsequent Q&A session to ensure that those questions are answered. They will also be submitted in writing following the webinar as well. Just want to make sure you get answers to the questions. So either way, we'll make sure the information gets to you. Next slide. And then the third opportunity for engagement is the monthly office hours. And on the last call, I was even asked if maybe we could make this more often. So I think we'll talk about that. This process will probably continue to evolve. But starting in September, so once we get through these webinars and the question and answer session, we will be hosting a monthly office hours that will be offered to all county BH staff and contracted practitioners. Representatives from the Centers of Excellence, HMA, as well as BHSA and BH Connect DHCS teams will be available to answer questions. So it's really an opportunity for as this initiative continues to roll out, and as you start to have engagement with the Centers of Excellence, or even understanding how this might work in your county, plenty of opportunities for us to bring a variety of topics together. What I will say is we'll probably have some identified topics. Perhaps there's a lot of questions that the COEs are receiving, or we're getting a lot of questions via email, or even through these webinars that we feel like we really want to make sure are brought up on monthly office hours. That might be an approach. We also will have an opportunity to really share county and practitioner insights and operational concerns and considerations. I think to me, it's an opportunity for counties to share best practices and insights and really learn from each other. We're going to offer them on a monthly basis. So September, October, and November. We will take a break in December. If there is continued interest, we can either make it more frequent, we can make it specific to both EDPs for our children and youth, as well as on the adult side, or we can even have specific ones for specific COEs. So this process will continue to evolve. One thing I'll also share, and I think if there is anything that comes from this, we want to make sure we're hearing from you and that we're answering your questions as we go along. The information that we gather during these discussions, we're going to use to put in collateral materials, put on the BHCOE resource hub. We're also going to try and incorporate them into any frequently asked questions, especially if the questions continue to come up or if there's specific guidance that needs to happen across all counties for this effort. So know that there's going to be some other additional support and frequently asked questions as well as materials to really support this engagement. Okay, I think that's it on my end. I think if we go in at this point, I think we're about 30, yeah, so we're about 2/3 of the way through our time together. Why don't we go ahead and stop the recording at this point?